Sometimes some patients come to you. Let me start with a very common one. You make prescription for them. They go to share those prescriptions with their relatives. Not supposed to be, because you could have diabetes, but at different stages of the disease. And these drugs, especially when you see a specialist in diabetes, we carefully select the drugs to fit the stage of your disease. Avoid some, because diabetes can affect different organs. And so sometimes when you take these drugs, they can affect these organs as well. So we carefully select your drugs. So they are individualized, not one size fits all approach to our care of patients. So we individualize care. So don't share your medication. Sometimes you see a patient, a couple will come to us and they say, my drugs finish, I have to take my wife's drugs. No, there's no love in sharing here. Okay. So you just stick to your drugs. Then the other thing again is herbal concoction. And some of these online products, they don't help. They don't. I've had reasons to engage some of these online drug sellers, and really drugs, but supplements. And some of them will shy away from talking to me because I want to ask questions. How do your drugs work? Where is the efficacy profile of your drug? How have you checked to see the side effects of your drugs? They don't bring down blood glucose, and the way we monitor blood glucose is not just waking up in the morning to check your blood sugar. Sometimes after meal, how do you fare in terms of your blood sugar after meal? Post meal blood sugar is even more dangerous than fasting blood sugar, and so those drugs don't help. Again, the other mistake we tend to notice is when patients come to us and a doctor who sits there with you has your best interest at heart. When we get to that point where we say you need to amputate your limb or your toe or any part of the body, it's not an easy decision to make. We understand, but sometimes you have to choose between life and losing just a limb, staying alive and losing. So you have to decide. And sometimes in September, I had this patient that came to us and I said, your toes are gone, we need to amputate. And at the time we would have done that amputation just around the leg. When we say the leg, like the foot, just a little above the foot, and that would have been better, because when he wants to use prosthesis, he fits better. But she left in September, and I told them it's a wrong decision you've taken. And I kept monitoring them. I didn't give up on them. I was sometimes checking to see how she's doing, and she resorted to doing herbal stuff, applied some stuff, and sometime in October or November they called back that the patient, a female, was confused, talking irrationally, and I had to rush down. I saw the wound heavily infected, and at this point we decided to do the amputation above the knee. So delay can be dangerous. So when you see a doctor, most a specialist, tell you, please, you need an amputation for you to stay alive, please. It's not an easy decision to make, but I will advise you do so. The other mistake we've seen with our patients is patronizing a pharmacist. You go, no, you are supposed to see a doctor who will tell you about the stage of your disease, who will tell you about possible comorbidities, because most of our patients with diabetes have other diseases. Diabetes can affect the liver, can cause liver enlargement and the rest. So when you see a doctor, the doctor tells you what you need to take at the point where he's seeing you, then you meet a pharmacist to dispense the drugs that are prescribed by doctors. Some people even go to patent medicine dealers to manage diabetes. No, they are not trained on how to manage diabetes. So those are some common mistakes that our patients make